Hi, I'm Danica McCrae. I have the pleasure of working with Mario Jara here at Austin Community College. He is an associate professor and simulation coordinator, and he has an extensive background in traditional and virtual sims. So the webinar you're about to see is on how to combine virtual simulations and products you might already have, such as your learning management system. We use Blackboard or Adobe Captivate, Articulate, or even Google Forms, and combine those two to produce next generation NCLEX style test items. So I'll now turn it over to Mario.
Thank you so much. This is the webinar version of the presentation, the Simulation Advantage for Next Generation NCLEX, also known as NGN, that was given at the ODIN 2021 convention. Today, we will be covering how to utilize simulation to help introduce NGN items to students. We will be focusing on using free resources and harnessing existing simulations. We have an existing workflow for distance learning at ACC due to the pandemic, as most colleges do. But now NGN looms in the horizon, and our students already have a lot of asynchronous screen time. So adding more testing on top of existing testing wasn't really the approach we were looking for when we wanted to tackle NGN. So we decided to start working on NGN materials paired with simulation content. All of our sims are formative, not summative, which is a great way to introduce and address NGN in a lower stress environment. So let's get started by going over an overview of this webinar. We're going to be going over 4 phases that we used for development and implementation, called From Needs to Delivery. And then we're also going to be talking about a scenario, an L&D scenario particular to ACC, and how we're going to be implementing NGN. Our objective is, upon completion, participants will be able to identify ways to prepare students for next generation NCLEX, incorporating virtual simulation, focusing on clinical cues and clinical judgment. Now, a special note for this webinar, this is a soft introduction to NGN, and the focus is getting used on the format. And we're going to be talking about that shortly in the next slide and why that may be important. So this is one of my favorite quotes about simulation. Simulation has the potential to capture the noticing, interpreting, and responding dimensions of clinical judgment by requiring classroom learners to perform higher order thinking rather than merely memorizing large volumes of information. And so what we really are after is that clinical judgment, and it's become a little bit of a buzzword, right? Clinical judgment, use this product for clinical judgment, this and that. But if you have been a clinical instructor, I don't have to tell you what clinical judgment is. You already know what clinical judgment is. You've seen it every time that you go out there with your students to the clinical site. And so you also know kind of like the classic case of the student that is just absolutely brilliant, that displays clinical judgment at the clinical site, but then when you go back to the classroom and you have to do testing, you kind of struggle a lot with the academic side of things. And that may be for a variety of factors. Testing anxiety can be one of them. Not being familiar with the rigor of testing and nursing could be another one. There could be various factors there involved. And so NGN can be a concern for us instructors when we're looking at those students. So we really at ACC are looking at doing, again, that soft introduction so that we can start introducing our items now rather than waiting until the standardized testing. Because again, if we're introducing the standardized testing right away and these students have never seen these items before, then how could we really assess, the validity or reliability of that test if that's not something that our students are familiar with? Now, earlier we talked about the needs assessment to delivery 4-step process that we kind of broke down into smaller chunks to get it done. And so we have identify needs, match content areas, break down and build up, and develop and deliver. And so for identifying needs assessment is crucial for the development of a strong simulation program. And you got to be looking into, what are the needs for your simulation program, for your overall program? What are the needs for students? How are we addressing the needs of students? And I also like to add, what are the needs for faculty? Because this is also very important when we're looking at delivering things, because faculty are the ones that are managing at times that delivery. So it's very important that we start taking ourselves into consideration. And in addition to this, needs assessment is also part of the standards, which are no longer called the NCLEX standards, but the healthcare standards, the healthcare simulation standards of best practice. This is specifically talking about the simulation design standard, criteria number 2. And so again, this is not a presentation on the standards of best practice, but do know that as part of that best practice, it is definitely outlined that we are out there doing a needs assessment to really make sure that, we're using simulation where it's most needed. And once we have our needs identified, then we want to go ahead and make sure that we are matching those content areas. Earlier, I talked about that we're going to be looking into an L&D scenario. And here at ACC, that was one of the areas that we identified that we kind of needed a little work in. And so now that we identified that content area, we're going to match it with a specific simulation. Now, simulation and how you access those simulations can be very different. We have homegrown solutions, and if that's working for you, great, you can utilize those. We also have free products and paid products. We're gonna focus a lot on free products, especially if you've been working in nursing education at the ADN level. You'll know that you have a lot of traditional students, but you also have a lot of not quite traditional students who may have limited time or a limited budget. And so when we utilize these free products, I think it goes a long way for the student population, especially if the faculty or the program, are not covering the cost. And sometimes those costs are passed on to the student, and everybody's on a tight budget right now. So definitely want to focus on free products out there. And once we have identified our need, we've matched it with a content area and a specific simulation. So we're going to go into the breakdown and build up phase, in which we are going to really analyze our simulation to make sure that it is meeting those learning objectives, and really kind of write down what is it that the simulation is telegraphing to our students. What are the cues that are being presented? What are the hypotheses that we want our students to formulate in their mind? And as a result, what is the clinical judgment that we're hoping that they'll arrive to? And if they don't arrive to that, we can always talk about that. That's why debriefing is for. But when we identify these various areas of the simulation, it becomes a lot easier then to formulate next generation items based off that. And there are 2 ways to do that. Hoping that you have multiple faculty that you're working with, that you can brainstorm by looking at what is being presented in the simulation, and then draw a new NGN item type from it, or you can recycle something that is existing. And that is also another thing that I think is great towards implementing this, is if you already have a bank of standardized NCLEX style questions, there are some ways to kind of take an existing question that you know is already a fairly valid question or that has gathered positive results, you know, while it's being applied in your exams, and kind of tweak it and transform it into a different NGN item type. And then once we've done, whether either creating the new item or we are recycling an old item, we want to make sure that we're keeping track of the items that we are pairing with our simulations. So we want to make sure that we write down the NGN item. And then last but certainly not least, at the far end, the fourth column is develop and deliver. So once we have that list of items that have been paired with the simulation, we're gonna want to transfer it to a platform to deliver it to the students. Like before, we are choosing something that is free. ACC is currently within the Google platform. If your school is in the Google platform, then you have access to not just a Google email or a Google associated email, but you also have things like Google Drive and Google Form. And as a matter of fact, if you can see at the top right now, there's several tabs on my screen. Everything, including this presentation, is being managed through that Google platform. So we'll have our Drive and our documents associated, and keeping everything kind of in one place and then delivering to the student goes a long way as far as ease of delivery and organization. If your institution is not on the Google platform, if you have a Gmail account, then you have access to the same tools. And if you don't have a Gmail account, it's free to create one. And then, of course, last on this column is piloting those NGN items to make sure that we are getting the interaction and responses that we're after. And then, of course, once we do that pilot, then we can deliver to the entire group of students. So that's kind of like the whole process, again, 4 phases, and each phase kind of has several components. Might look a little bit complex, but it's really quite simple when you break it down. So let's talk about putting that into practice. Here at ACC, we have a traditional curriculum, and one of our levels is composed of our specialties. And that specialty level has OB, PD, and mental health. For the purposes of this presentation, we're going to be focusing on the OB/L&D content. And we had some of our students that kind of were struggling with that specialty. And so we developed kind of like several items to kind of assist with that. And here we have the kind of the situation which we just talked about. Part of our needs assessment was having something that points back to what we need to do. So we have low scores in unit exams and standardized testing. And then we went in deeper and looked at what are the specific topics within that content area. And so that was identified as postpartum and then subsequently postpartum hemorrhage. And so we're gonna go ahead, now that we've done our needs assessment, we're gonna move on to looking for something that is gonna match that need. So here we have the postpartum hemorrhage sim by Montgomery College, which is a free resource available online. And they have some other scenarios which are also excellent. And I'm not going to go through the entire scenario. I may play just the beginning to kind of give you all a little bit of the feel for the scenario. But essentially, you know, we have the simulation in which we're observing the nursing care for Susan Brown, who is gave birth to a kid, and afterwards we have 2 nurses walk in, and they're doing kind of a change of shift and a shift assessment, and everything was looking pretty good up until it wasn't looking so good. We start having a complaint by the patient that states that she feels like she's peeing. The code PPH is called, and then we kind of start that whole chain of events that involves kind of getting the team involved and doing the fundal massage and having the midwife come in and assign team roles and give medications and so on and so forth. So this simulation here is about less than 10 minutes. So it's like a little bit over 9 minutes, but it's definitely very dense. There is a lot of content in there. And so we could definitely, if we go to the next step, which I'm going to pause this here, and we're going to go over to our next slide. We're going to be pulling a lot of clinical cues and hypotheses and judgments and actions from that. Now, of course, this is just very general overview. Within that 10-minute scenario, we could probably fill an entire page of everything that's in it. But so far, in order to kind of keep it simple and just kind of illustrate the concept, we kind of have three very, some specific to the simulation and others very generic. And so, for example, in here, we have like the blood pressure reading, feeling lightheaded, considering the patient's background, we may be thinking she may be at risk for bleeding, and we need to do a focused assessment, right? And then from that, we have, the patient complaining, observing a large amount of blood and clots, which leads again to our clinical hypotheses, postpartum hemorrhage, which leads to a judgment and action to call the code. Of course, this is specific to the simulation, but also applies to kind of like the overall what we're after. It's kind of like the pathophysiology and the kind of sequence of events. And so with the simulation, depending on what areas you want to target, within that simulation, you would write down and break down those clinical details so that you kind of can then extrapolate questions from it. And then we'll actually have a separate handout that we're gonna, or a second page that we'll look into that briefly. But once we do that, just before we switch tabs, is once we have our questions, then we'll start the development and delivery process. And so Google Forms is a great way to do that. Okay, so let's go back here. Like I was saying, this is the Google Drive where everything is stored. And in here, I have a worksheet. I have the presentation that I was using earlier, and then I also have the Google Form. So let's take a look at the worksheet first, which is just kind of more of a condensed version of the presentation. And earlier, we were talking about like just giving yourself plenty of room to kind of extrapolate those details from the sim. And so here we have like PPH sim clinical cues that we're looking at noticing. So again, the blood pressure, the large amount of blood and clots, uterine tone, et cetera, our hypotheses that we want our students to formulate, how they want to interpret what they're seeing. And then, of course, the same judgment or an action, how we want them to respond, what they noticed and interpreted. And so here, I have my clinical details. And this was just another L&D question. So a second-degree laceration, which our hypothesis we wanted to be that is a risk factor for PPH. And our action is a focused assessment. Once you have those details, you want to pick one of the new next generation item types. In this case, we're picking the drop-down close. And so for patient Susan Brown, the mention of blank during change of shift report puts her at risk of PPH. And then we see, of course, was it that she gave birth to an infant male? Was it the group B strep negative? Was it the spontaneous rupture of membrane? Or was it the second degree laceration repair? And we know that that is the key, so that is the answer. So we would go ahead and kind of write down each of our questions, and then we would go ahead and transfer them over. So that's the details. This part also is kind of like the whole entire process. So identifying needs, match content to sim, break down clinical cues right here, second degree laceration. And then our build up, we pick down the drop down close. And in here, as you'll see, multiple choice is kind of crossed out. And the reason for that is because most of our exams and quizzes are multiple choice, so we really don't need to develop any more of those. And then, of course, the following ones are the ones that, as reviewing some of the exams that and quizzes that have been given to some of our students, we just kind of noticed which item types had been reviewed or talked about, whether it was in a quiz or a lecture. And so, uncommon versus rare. So you really want to kind of take a look at what is available and what is it that you want to tackle. For us, we're really looking at working on drop-down close, matrix multiple choice, and matrix multiple response. For the development, again, there's a variety of options that anybody can use. For us, we're going to be sticking to the Google Drive, which is what we're going to take a look right now. So take a look at, again, our clinical details table and the item that we just wrote. Now we're going to head over to, this is what the Google form looks like. And so for the Google form, I should say, this is what it looks like from the point of the faculty point of view. And so we have included kind of like the simulation so that we know what we're referencing in, and then we have a variety of examples. And so it's all in one page. You just scroll down, and then this bar on the side is where you add questions, and then you can pick what type of questions you want. Before we go into further details, let's take a look at how it looks from the student side. So this is already made. From the student side, it shows the video if we needed to show that on where that can be delivered earlier. We click next, and then and here we have some of our questions. And so now this is something that I wanted to talk about earlier was in our table, we mentioned that we are either gonna, based on our clinical details, right, that we kind of broke down, we can either brainstorm new items or we can recycle new items, right? So if you want to recycle an item, start looking at multiple response, sometimes called multiple choice, that are already on your exams. So in here, for example, this is an example of a recycled question. So at the top, we have multiple response, select all that apply. Which of the following are risk factors for postpartum hemorrhage? And then, the student would click, whether you're using your LMS or you're using ExamSoft, whatever is it that you use, the student would click whichever they think the right answers were, right? This can be recycled or upcycled, if you will, into a matrix multiple choice. So we could say which of the following options may contribute to an increased risk for postpartum hemorrhage. And then you still list those same items, and then you just make one column that are actual risk factors and another column that is not a risk factor. So I know that's an example of just recycling an existing question into a new format. And then, of course, the reason why we wrote down, if we go back, the reason why we wrote down our question is because we're transferring it to here. So this is what it looks like once we implement it into the Google form. So again, for patient Susan Brown, the mention of during change of shift report puts her at risk of postpartum hemorrhage. And I understand that when they are taking the next generation NCLEX, the actual drop down will be embedded within the actual narrative space. But for now, this is kind of like a quick turnaround. So we would put here, second degree laceration repair. So that is how you either brainstorm a brand new question, so down here with the drop down close, or take an existing question in your exams into a brand new format. Let's see. So, and then additional questions based on some of the details, like based on the patient's verbalization of blank, the nurse should perform a focused assessment for a postpartum hemorrhage. Is it, I'm just tired and sore, or we're just glad this guy is finally here, or it feels like I'm peeing. So it feels like I'm peeing would be, the right answer. And then of course, another example, the nurse suspects blank may be the reason for the increased heart rate. Are we looking at postpartum pain, postpartum depression, postpartum hemorrhage? So incorporating, again, some of those vital sign readings that may occur in a simulation. You also have the ability to do matrix multiple response. This is one of the more complicated items, and this is why it's being left for last. And I'll go back and kind of show after I'm done demoing this, what it looks like from the faculty side and how I'm putting things together. So, but for now, the matrix multiple response, place a check mark in a box that you would expect to see the assessment finding with the associated health condition. And so in here, we have like a normal postpartum patient, an acute postpartum pain, and a postpartum hemorrhage case. And so the student would then have to really look and evaluate, like, would I see a decreased blood pressure in here and in here and in here, or does it only apply to one of them or two of them or none of them? And so that really makes them kind of flex that clinical judgment, critical thinking, and kind of higher order thinking, because you are asking them to compare and contrast and really link those assessment findings to whatever potential condition that they are seeing. Also, for those higher level learners, so when you're looking at potential students that should be taking care of more than one patient, you could potentially have a normal postpartum patient and an acute postpartum patient and a postpartum hemorrhage patient. And so we want to be able to kind of differentiate between them. And so that is another type of next generation item that can be done in Google Forms, the matrix multiple response. And one of the reasons why we're also pairing, with simulation is because some of these are very challenging. And earlier at the start of the webinar, we specifically said this is an introduction. We don't want this to be an exercise in frustration. So, we can work some of these through, for example, during a debriefing, and adopt kind of like a debriefing like model as we work our way through some of these questions. And that way we both get our debriefing and also introduce the next generation item types. But the advantage of this is, of course, that a lot of like your goals, your debriefing, everything has already been developed for you, and you just need to extrapolate that into the next generation item. So that's kind of like the student view. For faculty view, again, I usually just separate stuff into sections. So section 1 is kind of like the introduction, and then usually one question at a time is usually pretty good, unless you can have multiple kind of like drop down closes. And so in here for the regular multiple choice, you see that it's just the actual question at the top. and then the options at the bottom, and then you have an answer key, and you can see here the answer keys are already marked. I could go in there and change the answer key if I needed to. And then for the matrix multiple choice, which is our upcycled or recycled question from kind of a very classic multiple response, what we ended up doing is, again, we ended up putting kind of a similar stem of the question. And then on your rows, you go ahead and list all of your options. And then your columns are going to be either, is it a risk or is it not a risk? And then you also have the ability to select which one is, or your key, your answer key. So, you know, for our postpartum hemorrhage, we have our risk factors selected. So which includes everything but the maternal height. That is not a risk factor for postpartum hemorrhage. And that is like a very easy way to kind of manage that. You can see that there's also a point system if you want to make quizzes. I typically don't assign points for sim. We just tend to kind of like talk about them, debrief them, and go over them. But if you want to implement this system somewhere else, that's certainly something that you can do. You can do a point system, and you can also do automated feedback. But for the purposes of simulation, we really want that kind of personal, learner-centered debriefing interaction. Okay, now that we have talked about the matrix multiple choice, let's move on to the next item, which was the drop-down close. So from the drop-down close, from the faculty perspective, you'll see that it's, again, just the stem of the question with space in between. We have it, you know, as a drop-down type, and then we have our text options. So, and then 1, 2, 3, 4, and then our key is the one that's selected with a check mark. And if we wanted to, of course, we could select another one, which we're not going to do, but just for demo purposes. And then, of course, same thing for these other drop-down close, statement or stem of the question, and then space, drop-down, and selected answer, and identical to this item as well. Last but certainly not least is the matrix multiple response. This is going to be very similar to one of the items that we did earlier. But if you'll notice, in this one, you can actually select several choices per column. So if we scroll back momentarily, when we do our rows and columns in just the regular matrix multiple choice, we go to our answer key, it should be one choice per column. So it's either a risk factor or it's not, right? So make sure you don't make that mistake, because for some reason, this is allowing it to do that. But it should only be one or the other. But if you actually want something that can have multiple answers per column, then you need to pick the matrix multiple response, which here it's called a checkbox grid, excuse me. And so you'll, same setup, or I should say similar setup. You have your rows, and then you have your columns, and here we actually have 3 columns, right? And then our answer key will just allow you to select, okay, you know, could I potentially see these findings in these patients? And yes, you can see them in all of them. You could potentially just see them in 2 of them. You could potentially see them in 1 of them, depending on what your scenario, or none of them. And so it allows you to set that up very, very easily. And that's pretty much it for transferring over those items into what is that Google platform. Now, if we go back to our checklist here, so just to kind of summarize and end, We identified our needs. We matched our content, which was that great sim by Montgomery College. And then we wrote down everything or broke down our simulation into kind of those essential pieces. And then we built up our questions, whether it was through brand new brainstorming or recycling old questions into new item formats. Then we transferred it directly to our Google Suite. And last but not least, we have the delivery, right? So if we go back, I'm going to close here and pretend that we didn't see how the student's looking. If you click on the little, looks like a little eye preview icon. And so we click on that and it'll give us the preview, but we can just hit send. And I usually just grab the hyperlink from here. And that's how I can either email it to students or I could just post it on my LMS kind of hyperlinked. And that's how the student will get there. As far as evaluating your response, again, this depends on whether you want to format this as like a quiz or it's mostly for an introduction. Currently, we're only formatting them as an introduction so that the student gets practice. You do have a response area. You can have the form collect your responses. You can also create a spreadsheet that's going to collect all of those responses for you if you want to keep track of that. And then, of course, additional settings that everybody can take a look as far as whether you wanted a quiz or not, assigned values or not, and so on and so forth. But that is how you would deliver all of your work in one place over to a student with a single link. And that pretty much concludes this kind of like 4-step process that we talked about earlier. And that is how you can kind of essentially incorporate next generation items into simulations. And so just kind of, again, trying to do this type of prep work in a different environment, in a lower stake, in a less stressful environment, and hopefully so that when the students do get to take those standardized testings, they will be more confident. And that is pretty much it. That is how you can take, your existing resources and kind of bundle your simulations and your next generation NCLEX preparation into one. Thank you for attending this webinar. I hope that this kind of makes it into an easier or more structured way of achieving the goals of both simulation and next generation NCLEX preparation. I hope that this was helpful. And of course, as always, thank you to the collaboration between Unbound Medicine and Odin as well. Thank you and have a great day.